Welcome to Clear Answers About Clear Vision, the exclusive podcast series by Vance Thompson Vision. Our goal is to empower you with the knowledge and insights to make informed decisions about your eye care. Whether you're exploring options for vision correction, cataract surgery, myopia control, or oculoplastics, we're here to guide you. This podcast is dedicated to helping you achieve clear vision, one episode at a time.
So hello and welcome to today's podcast. We're going to be talking about refractive lens exchange today. And if you don't know what refractive lens exchange is, you've found yourself in the right place. And this will be a great podcast for you. I think we should go around real quick and do some introductions. I'm going to be moderating today. My name is Spencer Morton. I'm a cataract and glaucoma surgeon at Vance Thompson Vision in South Sioux City, Nebraska. And why don't we start with Sierra, go to Mitch, and then Dan.
Awesome. My name is Sierra Steiner. I'm an optometrist at Vance Thompson Vision in Billings, Montana.
Hey guys, Mitch Ibach. I'm an optometrist with Vance Thompson Vision in Sioux Falls.
And I'm Daniel Terveen. I'm one of the cataract surgeons here in Sioux Falls.
Awesome. So I'm just going to kind of go around the horn here and hit you guys with some questions, hopefully stimulate some good discussion and be educational for our patients who are watching this. So the first question I want to ask is for Mitch, and that is, could you describe for maybe people who don't know, what is a refractive lens exchange and maybe how is it different from things like cataract surgery or LASIK and other vision correction surgeries?
Yeah, well, let's start at the very foundation, which is the lens. The lens in our eye is a lens like one in a camera, and that lens flexes to help us see up close for most of our patients. And so the normal maturation of the lens when we're in our teens, 20s, 30s, early 40s, the lens is crystal clear and it flexes. That helps us zoom in to see up close. And then when we get into our late 40s, 50s, 60s, the lens is still clear. It just doesn't flex like it used to. And so we call that dysfunctional lens syndrome or presbyopia. And then eventually in everyone, if you get enough candles on your birthday cake, the lens becomes cloudy and opaque. And then that's cataract surgery. A refractive lens exchange is the same surgery. We're just taking out the lens before it's a true cataract, before it's medically necessary and the lens becoming opaque so that patients can't see through it anymore. Patients who have a refractive lens exchange in almost all cases can still see well in their glasses or contact lenses. They're just hoping to gain some independence from glasses and contact lenses. But it's really the same surgery.
Sure. And Sierra, I heard Mitch talk about, dysfunctional lens syndrome or presbyopia. If you're were a patient listening to this and you're like, boy, how do I know if I have those things? How do you think a patient would know if they have presbyopia or dysfunctional lens syndrome?
Yeah, I would say it's when you're having to start to stretch your arm out a little bit more to read things or get a little better lighting, or if you're somebody who's nearsighted, maybe taking your glasses off to read. Those would be the early kind of first signs of that.
Yeah, or maybe if you're someone who's already kind of caved in and gotten a pair of reading glasses or have had your glasses changed to a bifocal pair of glasses. And Dr. Terveen, what do you think are some of the, more practical differences between, say, a refractive lens exchange and something like, LASIK?
Yeah. So it's really the anatomy on where we're operating is the differences and what we can do for people. So with LASIK, we typically work on the cornea, or PRK. We're doing work on the cornea to change the shape of the cornea, whereas Mitch kind of suggested we're taking the actual lens out, a different part of the eye when we're doing a refractive lens exchange. And the goal for refractive lens exchange is really to give people back their ability to see not only at distance, but also up close. And so it's people who've lost that ability to read is really when we start talking about refractive lens exchange, because that lens no longer flexes. Whereas people who are getting LASIK are often people that can still read up close without glasses, and they just want better distance spectacle independence because they still have that accommodation or that ability to see up close. And so those populations, there can be some overlap when we do LASIK and RLE, but it's often people who are at kind of different phases of their visual journey.
Yeah, and you heard Dr. Terveen say RLE, and that is just a abbreviation for refractive lens exchange. So if you hear anyone in the remainder of our talk say RLE, what they're referring to is a refractive lens exchange. So, I also heard you say, there's some overlap, with certain patients that could be a candidate for both, and then there's certain patients that should, definitely do one or the other. I wonder if anyone would chime in on what are some of the benefits of doing something like a refractive lens exchange, especially for patients that are in that presbyopic age or are over the age of 40.
I'll take this one. And so with corneal refractive surgery, anytime we're working on the cornea in one eye, we can improve distance, intermediate, or near. But once the lens starts to lose its flex, or we enter those ages for presbyopia, we can't improve all three in the same eye. And so then if we're doing corneal refractive surgery on a presbyopic patient or a patient who's lost their lens flex, we're usually targeting distance or near. And so occasionally we'll offset the eyes or do something called monovision, where one eye is more for distance, one eye is more for intermediate and near. With a refractive lens exchange, we have the ability to use lens implant technology that is like a bifocal or a trifocal in a pair of glasses or in a contact lens. So it helps correct distance, intermediate, and near in the same eye. And so patients just get a larger range of vision for intermediate and near when we're doing a lens-based refractive surgery once we enter those presbyopia years.
Yeah, and an additional point to that is with LASIK, we have more limited treatment ranges. You can only do so much nearsightedness or so much farsightedness. And that is also true for a refractive lens exchange, but the range is much larger. And so in certain patients that are even in their 30s, but they have such a massive prescription that LASIK is not a good option for them, or they have an option where a different type of corneal or refractive surgery isn't an option. The RLE might be the only option for some patients who want to become more spectacle independent.
Yeah, I think the other thing that I would add is, when you do get into that crossover age range, you start to think about someone who is going to need a cataract surgery in a not too crazy distant future. And if you do a LASIK, you're doing something that has kind of a temporary result, right? Because eventually it's going to be changed when they ultimately have a cataract surgery. And as you are starting to develop, a dysfunctional lens and some early lens changes, you're doing LASIK on a changing system. So as the cataract is maturing, a patient's prescription can change a bit through time. Whereas if you're replacing the lens, you're getting a permanent outcome and you're getting a kind of unchanging system after the results are finished. Any other things to add, or can we move to part 2? So let's move to part 2. So this is a little bit more about, what the refractive lens exchange experience is like for patients. So maybe Sierra, you could start us off, kind of explain, the procedure a little bit, explain what a patient should expect kind of before, during, and after the surgery.
Yeah, they'll come in for an evaluation prior to the surgery to basically find out, am I a candidate, and what lens options are going to be the best. And so we call that the evaluation, and they usually spend about an hour and a half in the clinic. They get their eyes dilated. They go through a whole bunch of tests to help us recommend the best technology for their eyes. And then surgery day, usually about an hour and a half, again, to probably be in the surgery center with a procedure that takes maybe 10 minutes or less per eye. And then typically, they're getting a pretty nice relaxing medication for that day. So shouldn't be uncomfortable, shouldn't be real anxious about it. And then afterwards, usually just telling patients, take it easy for a few days. Vision should be pretty good within a day or two of healing. And then minor adjustments maybe that come after that, or minor improvements that come after that as, the dryness improves and things like that. But overall, a pretty streamlined process from start to finish.
Perfect. And, Dr. Eibach, I want to talk to you about this. I know that we all know this, but patients may not. When you have a refractive lens exchange, you have that lens that's in your eye that's being removed at the time of surgery. And once that lens is removed, we have to replace it with a new lens. And that's where the patient is going to be presented with a decision, right? Of, hey, which lens would you like put into your eye? And not every lens has the same capability. So when a patient is maybe discuss a little bit some of the lens options that patients can be presented with, and maybe how patients can be guided on matching those lenses to their lifestyle and their goals.
Yeah. I think a difference between cataract surgery, where it's medically necessary, and a patient undergoing refractive lens exchange, for almost all of our patients undergoing a refractive lens exchange, gaining independence from glasses and contacts is one of the driving goals. And so we'll start with talking really about the outcomes that a patient wants to achieve. And so I'll commonly say, are you hoping to do most of your activities at distance without glasses and you're okay wearing reading glasses for intermediate and near? Or are you hoping to gain as much glasses independence as possible? And so we'll start to tailor or customize the implant options based on the patient's goals and what they want to do. And so we're having conversations about what they do for employment or their work, their career, what they like to do on the weekends, what are some of their most important hobbies. And then we can really tailor or customize the implants. And all of our implants have really strong characteristics, and then maybe somewhere where we have to give or take on some things. And so we're able to bring that patient in, kind of listen to how they want to use their eyes and their vision, and ultimately tailor or customize it for them. And I try to primarily talk in outcomes or what we're hoping to achieve afterwards, rather than the specific technology or names.
Yeah, I think that's a really good idea. I usually tell patients, my goal is not to tell you what to do, is to tell you the options that you have and then what your life and vision will look like with each of those options, and then let you pick the one that you feel suits you the best and, will achieve what you're hoping to achieve the best, because all I want is for you to be happy. And a lot of people can be happy with a lot of different options. You just got to find the one that works best for you. Dr. Trevino, I wanted to talk to you a little bit about, kind of the way that we do the surgery these days. Things have changed a lot through the years. So talk to us a little bit about kind of the diagnostics that go into making a surgical plan, and then kind of some of the modern surgical techniques.
Yeah. So for most people, the surgery is identical to a cataract surgery. Kind of like Mitch said, it's just the indication is different. In cataract surgery, you have a lens that's no longer clear and it's cloudy, whereas in RLE, you have a lens that has lost its flexibility, but it's not cloudy or discolored. And so the procedure itself is identical, though. So if people have had friends who've had cataract surgery and they said, oh, it was really easy, it was a little bit scratchy that day, but by the next day it was feeling good and I was seeing good. It's a very similar experience for RLE for people. And there's a lot that goes into making modern surgery that quick of a recovery. And it starts with the pre-op diagnostics, looking at the tear film, looking at the cornea curvature, looking at the retina to make sure the retina is healthy, that there's no signs of glaucoma. And so a whole litany of advanced diagnostics, just making sure that the eye is healthy enough and that there's no other underlying pathology that could cause people to be unhappy with their vision down the road. And so we want to make sure there's no stone unturned before we go into surgery. The surgery is fairly straightforward for people. It's a small incision, there's no stitches, the wounds seal up on their own. And for most people, the eye is scratchy for the day of surgery, but by the next day it's feeling good. And sometimes we'll even do these procedures, both eyes in the same day for people, so they can get back to their normal life faster. In the surgery, we're doing a lot of additional things to make it as comfortable and as convenient for people as possible. Most of the surgery is done with ultrasound, though sometimes we do use laser intraocularly for part of the surgery. But typically for most people, it's done with ultrasound, and they're mostly painless, like Sierra kind of mentioned, for most people, and they're seeing good really the next day.
That's awesome. Dr. Eibach, I want to switch back to you for a quick second, because I know that we had a quick discussion about lens choices and, what will match people's goals and abilities. And I think sort of as like a little VTV exclusive here, we've had some early access to some virtual reality technology that, I feel has been really powerful in helping people kind of take that next step in realizing, okay, here's how I'm actually going to see with surgery and making a decision. Would you talk a little bit about that virtual reality technology that we've been using and kind of how you've seen it help your practice?
Yeah, I think the unmet need is a lot of patients come into our office for an evaluation and they maybe have 10 to 20 minutes with the doctor to make a decision on how they want to use for the rest of their life. And even though I think we're really, really good at educating and talking about options, it's hard for patients to feel that or see that in a real way. And so Greenman is a company that uses a virtual reality headset device to try to simulate different implant outcomes as well as different situations. So what near vision looks like if we don't correct it with glasses or an implant, what glare and halo might look like with a certain lens implant. And so really can kind of let patients be in the driver's seat, experience it to the best that we can, ultimately to help them make a more educated and confident decision.
Yeah. And
Yeah.
one thing
So
for patients, sorry, Spencer, for people who have astigmatism or they've been told I have an astigmatism, and what does that mean? How does it look if I get that corrected versus if I don't get that corrected? And giving patients an ability to kind of experience, okay, and an astigmatism is just, the eye being more football shaped than round shaped. And the intraocular lenses that we use can correct all of that. So I think giving people an opportunity to experience what's it like to get that corrected versus not corrected can be really helpful for people.
yeah,
Oh,
go ahead, Sierra.
just one thing to add is that, I can't probably count the number of times where in the exam room, patients will say, man, I just really wish I could try it before I make the decision, especially if they're kind of on the fence between two lenses or something along those lines. And so I think it's a nice way to give them, a little bit of real world experience before making that big decision.
Awesome. And just real quick, a closing note before we move on to our final section. I think it's important for patients to understand that a lot of times they're not being referred to us for a refractive lens exchange evaluation, right? A lot of times people end up at the finish line of needing a refractive lens exchange because their optometrist or their eye care provider has astutely noticed, hey, you're not seeing as well as you want to, and there's options for that. And it may be LASIK, it may be PRK, it may be, refractive lens exchange or some other vision correcting technology. So it's good that people are just aware that this exists and that they may think they're coming in for a LASIK evaluation and then they're told of this, refractive lens exchange. So it's something that's very important to be aware of. So the last section I want to talk about is, mainly just like results with refractive lens exchange. How do these people do? And then if any of you guys have any insightful questions that are maybe frequently asked by patients that we haven't touched on yet. So, kind of the first one is, I'll ask you, Dr. Steiner, as far as the outcomes of these surgeries from refractive lens exchange, what are some of like the realistic outcomes that we can see, and what should patients expect their vision to be like when they're done?
Yeah, I think one of the big things that I tell patients is, there's that we're all wired a little bit differently. I use that phrase a lot. And so we could put the same lens in, 5 different patients, all who are good candidates for that technology, but what one tells me afterwards might be a little different than what the other one tells me afterwards. And so, I try to educate them as best I can from what I know, and then explain to them that, there are going to be things that as you go through the healing process, we might work through together. But we'll hold your hand, we'll get you there. And luckily, majority of patients are there within a couple of days. But it's a process that we kind of go on with them.
And so, Dr. Eibach, if we have a patient that maybe just isn't right there, we don't nail it right off the bat, or, there may be a month or two out from surgery and they're just not quite seeing how they had hoped to see, what can we do to help kind of get these people into the end zone? And is there a sort of adjustment period that, is practical for people to expect? And, what do we do in those instances?
Yeah, I like to preoperatively talk to patients going into a refractive lens exchange about the journey that we're going to go on. And in many cases, it can be a 3-step process. The first step is to do the actual surgery where we're taking out their natural lens and putting in the new intraocular lens. And for some patients, they're just done. They're wildly happy a week or a month later, and we don't have to do more. Probably for about 50% of patients, though, at about the 3 to 6 month mark, commonly will need to clear up some film haze scar tissue. Their body kind of heals and wraps the lens around, and then we go in and do a little bit of laser called a YAG laser to touch that up. And then in maybe 15 to 20% of patients, we need to fine tune the prescription a little bit, doing laser vision correction like LASIK and PRK. And so I think that's an important point for patients to know, is we have an enhancement plan or a backup plan in place. And not every patient needs that, but we're building that in on the front end. And then in these patients, I really want to get to minimum 6, very commonly 12 months for what we call neuroadaptation. We need the eyes and the brain to kind of circuit themselves to be able to adjust to these lens implants, to be able to adjust to a new kind of optical system in between the eye and the brain. And so that's the process that I talk about with a lot of patients.
And as
Yeah,
far as outcomes, Spencer, I think with today's modern technology, I completely agree with everything Mitch and Sierra said. It's a process to get people there, and you need to know going into it and make sure that when you're getting this procedure done, that the care team has that plan and has that ability to make sure you get to the end zone, because it's so important to get people those final couple of yards sometimes. But with today's modern technology, what people can expect is to be out of glasses for most things. In the clinical trials for a lot of the lenses, 95% of people, when asked if they used any sort of glasses in the past week, 95% of people say, I never used any sort of glasses in the last week. And so if you're someone who's 52 and you're using cheaters for everything, or you're just using cheaters to be on the computer, you could expect to not use cheaters for that. If you're someone who likes to golf and needs glasses for distance, but also wants to be able to see the dashboard, you should expect to not need glasses for that. Now, there are certain things you might need cheaters for. In the clinical trial, people said I needed cheaters to thread a needle in dim light or things like that. But if you're going into this surgery with today's modern technology, you should expect to not have to use glasses for much of anything afterwards. And so I think we can give people really good glasses and spectacle independence, as long as we're choosing the right lens for the right person and we're being really clear about some of the downsides or drawbacks to certain lens technology.
Yeah, just to kind of circle the wagons here a little bit. I love this because the next thing I was going to ask about is kind of frequently asked questions. One of them that I hear oftentimes is, what can I expect to see? Another one is, what happens if I can't see those things? We've touched on both of those. And then another one, which Mitch kind of indirectly touched on, is, my neighbor said that their cataract came back after surgery. What happens when my cataract comes back? And, as Dr. Eibach had discussed, sometimes people get what's called a posterior capsular opacification, where the bag that holds that lens can become cloudy over time, and it's treated quickly. It takes about 60 seconds, and we do it with a laser. It only has to be done one time. And I think people knowing about that and a potential, laser refractive procedure that could need to be done ahead of time are both very valuable. Just in closing, does anyone else have any kind of recurring questions that you hear from patients, either in the preoperative timeframe, postoperative timeframe, or right around the time of surgery, that we think would be helpful to answer for our potential patients listening right now ahead of time?
Yeah, I often hear, how long does this last? And we kind of touched on it. Some people hear, oh, my LASIK wore off, or things like that. And so with refractive lens exchange, the lens lasts forever, typically, for most people. Once they've had that lens exchange, they don't need to have cataract surgery in the future. They don't need to have that surgery again. They might have a polishing like you talked about, but once the procedure's done, this should be the vision they have for the rest of their life, barring they don't get any sort of other pathology. And so it does last forever for most people. Typically, like I mentioned, patients can get these done in the same day.
I think one other thing that, even once patients kind of wrap their head around, I don't have to have this surgery again. A question that I hear often is, well, am I going to have, prescription changes, yearly prescription changes, where I have to, even if I don't need glasses right away after surgery, am I going to get some changes down the road, and then a little more after that and a little more after that? And same with near vision, even if I get good near vision right away, in 5 years, am I going to need to wear reading glasses?
Yeah, I think the other one that I've heard people say is, well, what's going to happen when I, need cataract surgery? And you get to tell people, hey, well, if you do this procedure now, you actually won't ever have to have a cataract surgery, because you'll never develop one, because we're going to take the lens out now before it becomes a cataract. So that's another one that I've heard before. Any other ones before we close up here?
In the beginning, we talked about the differences between a refractive lens exchange and cataract surgery. And one of maybe the big ones that I missed is a refractive lens exchange is not a insurance-based procedure. And so this is an out-of-pocket or refractive cost, almost like a cosmetic procedure. Those costs differ depending on the type of surgery and the lens that we use, but just important for our patients to know you won't come in and use your medical insurance to help pay for this.
Yeah, just like other things like LASIK, and even though it's a really great opportunity and a way to kind of change the way you see for the rest of your life for the better, things that are not viewed as quote medically necessary, typically insurance companies don't chip in on those. So yeah, another great point. Well, I think we've done a really good job of covering all the high points of refractive lens exchange. Dr. Steiner, Dr. Trevine, Dr. Eibach, you guys have been awesome. Thanks for your time, and until next time. Have a nice day.
Thanks. See ya.
Thank you for listening to Clear Answers About Clear Vision, the exclusive podcast by Vance Thompson Vision. We hope this episode has empowered you to take the next step toward achieving clear vision. If you found this information helpful, please share it with a friend who might benefit too. Ready to take the next step? Schedule an evaluation with our expert team or visit us online at vancethompsonvision.com to learn more. Together, we'll help you see the world more clearly, one decision at a time. Until next time, take care and keep your vision worth seeing.